Welcome back. Let's go to health matters now. No fewer than 9 people have died of Lassa fever in Benue State in northern Nigeria in the past 2 months. The state epidemiologist, Dr. Ngishe, disclosed this to journalists in a chat. This comes after the Nigerian Center for Disease Control and Prevention said that it had recorded 2,621 suspected Lassa fever cases and 84 deaths with a case fatality rate of 18.6%. According to Ngishe, 46 people, including health workers and internally displaced persons, have been hit by the dreaded disease across the state. He notes that 4 cases were found among the internally displaced persons at Otese IDP camp in Guma local government area of the state. Well, joining me this afternoon to discuss this further is the chairman of the Nigeria Medical Association Infectious Disease Community. He joins us from Enugu State. Dr. Amobi Omoha, thank you so very kindly for your time. Good afternoon.
Thank you for having me.
Now, please throw some more light on what Lassa fever is and how one can differentiate Lassa fever from other acute viral hemorrhagic fevers.
Okay. Lassa fever is RNA virus disease caused by Lassa virus. It is being transmitted by a rodent called Mastomi matrensis, which is a multimate rat. So, person can get it when you come in contact with food material infested by the urine or the fecal matter of the rat disease, or when you come in contact with the body fluid of infected person. Then the history is when they are called first in Benue State, January 1969. It affected the missionary nurse working there. It's a very notifiable disease and of public health importance because of its epidemics and the case fatality rate. We can differentiate it from other viral hemorrhagic disease in terms of route of transmission. In case of Lassa fever, the route of transmission is through human being and through infected. While in case of yellow fever, which is another type, or Ebola, get it through monkey and the mosquito.
All right.
In terms of yellow fever, we now have the vaccines. If you take a vaccine for yellow fever, it can prevent you up to 10 years. But now, with Lassa fever, we don't have vaccines, which give us a cause of concern. Lassa fever occurs mainly in dry season, this period, because of farm factors. But in terms of yellow fever, there's no seasonal variation. In terms of Lassa fever, you can also talk about other things that makes it, the fatality rate, the symptoms, all these things. Even in terms of microbiology, Lassa fever is adenoviral disease, while other virus is also different from it in terms of microbiological classification. These are the areas you can classify and differentiate it between Lassa fever.
Amobi Omoha, given the recent surge in Lassa fever cases in Nigeria, what factors do you believe are contributing to the spread of this virus across multiple states in Nigeria?
Okay, thank you for that wonderful question, because it's really a case of concern for the federal government, the citizens, and everybody in Nigeria, because it's a cause of concern. Like now, if you look at the number, we have about above 2,000 cases of suspected cases. We have about 400 confirmed cases across 83 local governments and across 23 states. So it's a case of concern. The factors that can lead to upsurge of those things are population migration. People are now moving from area of endemic to non-area of endemic, thereby spreading it. Another thing is awareness. If you look before, we have about 2 molecular labs in the country, but now we have about 8 molecular labs. With that, we have prompt diagnosis and report so that within some few days, you can have the result to confirm that this person actually have Lassa disease. Another thing is in terms of gap between the environment of animal, the rodent, and the human being. Now, because of a building of estate, deforestation, and other things, the rat actually move because the rat stays in the bush or the peri environment. It moves now from the bush to human environment, that is the house, thereby contributing the food material that human being get involved with. So these are the factors that cause the upsurge. Another one is also the level of poor sanitation. There's no IPC. That is where the government come into play. They should get awareness. The IPC, the poor sanitation leading to overcrowding, thereby causing that upsurge because human-to-human contact because of overcrowding are now common. These are the factors that lead to upsurge in the society now. And it's a case of concern for all of us because any of us can be a victim.
All right, talking about any of us being a victims, let's look at the health sector. Can you give us some insight into the challenges faced by health authorities in Nigeria in effectively managing and containing outbreaks of Lassa fever, especially in densely populated areas?
Okay. The challenges, the health factors faced is one, poor infrastructure. We don't have enough infrastructures in the hinterland and the area. So when you go to the hospital, because of the few and lack of infrastructures in the hospital, it delays diagnosis. In terms of management of the patient, we don't have enough PPE. Some hospitals, you find it difficult to find common glove that will help us to even protect before touching the patient. Those are the factors. Another one is poor sanitation. There's no sanitation. You will see people dumping refuse around the house without poor adequate control of sanitation, thereby attaching that rodent, which we call marmot rodent, or another word for it is Mastomenia natalensis. Those are the factors that make it difficult. Another one is there is poor education and the training of the staff. There is no fund to train the staff on IPC. IPC means infection prevention and control for the staff to be aware about how to handle the patient. There is no awareness on how the patient that die of Lassa fever should be buried. They burial right. People do what they think is perfect for them and thereby exposing other people to danger. So, but when these things are kept in place, and these things are what we should get at the policy levels, because we're talking about prevention, they have secondary prevention, primary prevention, and tertiary prevention. The primary prevention is where the government make policies. The policies is what they do because they look at the health system to work. The governance and leadership have to be in place. If they have a good primary prevention, there is be health promotion about it, there be awareness, there will be training of the staff. And when we do these things, we get it right and we protect the citizen and protect everybody because the disease is really causing an upsurge in the society. Thank you.
Thank you so very kindly. Before we go, let's just find out from you, in your opinion, how can health care facilities enhance their capacity to be able to diagnose and treat Lassa fever cases promptly?
Okay. I love that question because it involves all of us in healthcare services. The first thing we need to do to get it right is educating ourselves on the symptoms, signs of Lassa fever, because that will bring us to high index of suspicion. One important thing to note is because the symptoms of Lassa fever can come as symptoms of typhoid fever or malaria, thereby giving the healthcare provider who have to come in contact and diagnose it a different view. But when we have high index of suspicion, we can always suspect and do triage in case we have a patient. Another thing we need to also do is training of ourselves on IPC. IPC means infection prevention control. When we train ourselves on that, we will know what to do, how to handle patients, how to use PPE, and how to do that. Another factor that can help us to increase our capacity is utilizing the molecular lab that we have now. When we utilize it and make adequate diagnosis, we can actually separate suspected cases from the real case so that we employ every possible measures to tackle the infection. Another thing I also think is important we do to enhance our capacity is synergy collaboration with NGO, the government, even the opinion leaders in the state. We discuss with the opinion leaders like Reverend Fathers, the Igwes, the traditional rulers, so that they will educate everybody in the community about high index of suspicions, so that as they are coming, they were able to give us the signs and symptoms the patient presents. Because as I said earlier, apart from other symptoms like bleeding from nose and mouth, it can present with symptoms that confuse the healthcare providers. But when we maintain that high index of suspicion and do all these things, we will improve our capacity to diagnose it and save life, because it's a case of concern that we act and save life.
Okay. Dr. Amobi, Omoha, many thanks for your time this afternoon.